The senator from Washington.
Mr. President, I come to the floor this morning to join with the senior senator from Colorado, and I want to thank him for his excellent statement and his leadership on this issue as we kick off this really important debate on our bill, the Protect Women's Health from Corporate Interference Act, or as you just heard, the Not My Boss's Business Act. And I want to start off by asking our colleagues a few basic questions. First of all, who should be in charge of a woman's health care decision? Should it be the woman making those decisions with her partner and her doctor and her faith? Or should it be her boss making those decisions for her based on his own religious beliefs? Well, to me and to the vast majority of people across the country, the answer to that question is obvious. Women should call the shots when it comes to their health care decisions, not their boss, not the government, not anyone else. Period. But, Mr. President, we are here today because 5 men on the Supreme Court disagreed. 5 men on the Supreme Court decided there should be a group of women across America who are required to ask their boss for permission to access basic health care. 5 men on the Supreme Court decided that a corporation should have more rights than the women it employs. 5 men on the Supreme Court rolled back the clock on women across America, and we're here today because we cannot allow that to stand. People across the country think the Supreme Court was dead wrong on this decision, and we are here today to be their voice. Mr. President, when we passed health care reform, we made sure that every woman has access to basic health care, including contraception, which is used or will be used by 99% of the women in this country. And when 58% of women use birth control for purposes other than pregnancy prevention, including managing endometriosis, ovarian cysts, and other medical conditions, we know this provision could have a sweeping impact on women across our country. In fact, according to the Department of Health and Human Services, 30 million women nationally are already eligible for this benefit. And when the law is fully implemented, 47 million women nationally will have access to no-pay birth control thanks to the Affordable Health Care Act. And by the way, thanks to this benefit, women have already saved $483 million, and that's just in the last year alone. Mr. President, contraception was included as a required preventive service in the Affordable Care Act on the recommendation of the independent nonprofit Institute of Medicine and other medical experts because it is essential to the health of women and families. After many years of research, we know that ensuring access to effective birth control has a direct impact on improving the lives of women and their families in America. It is directly linked to declines in maternal and infant mortality, to reduced risk of ovarian cancer, to better health outcomes for women, and, by the way, far fewer unintended pregnancies and abortions, which is a goal we all should share. We should all know that improving access to birth control is good health policy and it is good economic policy. We know it will mean healthier women, healthier children, and healthier families. And we know it will save money for businesses and consumers. But with their ruling setting a potentially dangerous precedent, the Supreme Court has not only inserted a woman's boss into her health care decisions, in many cases, they've given him the final word. Mr. President, in the aftermath of this decision, women across America are turning to Congress and demanding that we fix this. And by the way, it's not just women who want Congress to act. People across the country understand if bosses can deny birth control, then they can deny vaccines or HIV treatment or other basic health care services for employees and for their dependents. And I think what men across America understand, it's not just the female employees who are impacted, it is their wives and their daughters who are on their health care plan as well. As the ink was still drying on Justice Alito's misguided opinion in this case, I made an unwavering commitment to do everything I could to protect women's access to health care since the 5 male justices of the Supreme Court decided they would not. That is why I've been working with my partner, the senior senator from Colorado, to introduce this bill. And I'm proud that in the many days since then, we have received such strong support from people across the country. Our straightforward and simple legislation will ensure that no CEO or corporation can come between you and your guaranteed access to health care, period. This shouldn't be a controversial issue. The only controversy about birth control is the fact that it is 2014 and women across America are still fighting for this basic health care. Mr. President, the data is clear. Ensuring access to contraceptive coverage isn't just the right thing to do, it is a critical part of making sure that women and their families have a fair shot. In the 21st century, women and their families shouldn't be held back by outdated policies and unfair practices. And again, it's not just about access to contraception. This includes pay equity, access to child care, higher minimum wage, and it absolutely includes the right to make their own medical and religious decisions without being dictated to or limited by their employer. The bottom line is this: women use birth control for a host of reasons, none of which should require a permission slip from their boss. So I want to thank Leader Reid for moving this bill to the floor so quickly and for his commitment to getting this done, because women across the country are expecting action. They do not want to wait. And as we move forward on this bill this week, I hope enough Republicans can put proven science over their partisan politics and join us and revoke this court-issued license to discriminate and return the right of Americans to make their own decisions about their own health care and their own bodies. And I want to thank Senator Udall once again for his work with me on this common sense and bicameral legislation. I also want to just thank the members of the House Pro-Choice Caucus who've introduced their companion legislation in the House. And I, again, sincerely hope that our Republican colleagues on both sides of the Capitol join us. And for those of them who don't, for those Republicans who've already said they oppose our legislation, I really am interested in hearing their answer to the question I posed a few minutes ago. Do they think bosses should be in charge of a woman's healthcare decision? Do they think women should have to ask their boss permission for healthcare used by 99% of the women? And do they think that we as a country should start down the path where CEOs and corporations can start making decisions for all kinds of health care for their employees? Mr. President, women across the country will be watching this debate, and I think they will be very interested in seeing who is on their side. Thank you, Mr. President, and I yield the floor.